Hey guys, welcome back to my channel. If you're new here, my name is Krista. I'm an international mama of two, a dental hygienist turned midwifery student. And here on my channel, I'm going to be talking about all things motherhood, midwifery, pregnancy, and childbirth education. So if these things are of interest to you, please follow along and get ready to birth and bloom. Hey everyone, welcome back to my channel. It's great to see you. So this week we are talking about a subject that's a little bit more of a challenge, but I do feel like it's a conversation that needs to be had and can really help you if this is something you're experiencing or something that comes up for you in the future. So what are we talking about today? Well, we're talking about miscarriages and pregnancy after a loss. So I want to preface this story and let you know that this is my personal experience. I found that knowing women that have had a similar experience were really helpful to go to and talk about our stories to really, best manage how I was processing the whole experience. So let me start from the beginning. Okay, so I want to preface that we're going to be talking about loss. We're going to be talking about what a miscarriage is, your different options if you do learn that you have a miscarriage. We're going to be talking about kind of how the process goes and hopefully give you a little bit of hope too, that if this is something that you're experiencing, hope is not lost. There's a bigger plan, there's a bigger picture. And I know it's easy to say because I'm 2 years out from my experience, but I know full-heartedly that my miscarriage experience has better prepared me for what I want to do in my life and helping others. So let's talk about my experience and kind of go back in time and paint the picture. Okay, so this was 2 years ago, a little over 2 years ago. My daughter was just had turned 1 year old, and my husband and I were eager to expand our family. And I am very fortunate that I am a fertile lady. And so December was when we were starting to try for our second baby. So I got pregnant right away in December, and my husband, my daughter, and I were doing a trip with my in-laws going to Mexico. And I had a feeling that I could be pregnant, but I wanted to take a test prior to going on our trip because I needed to know if I was going to be able to drink alcohol or not. So I took a test first thing in the morning. It was positive, and I was like, oh wow, like that was fast and really excited. But also, I don't think I fully digested it, and I kind of told my husband quickly, and we laughed because it was like our first time trying again, and with our first daughter, we got pregnant right away as well. So we felt really fortunate that we got pregnant really quickly. So we get to Mexico, we're with my in-laws. I told them that we were expecting our second baby. And, I told them with the hopes, of course, this is going to be a beautiful, healthy, normal pregnancy. But something was telling me in the back of my mind, this experience, that maybe something wasn't quite right. I remember specifically saying, in case this is not a viable pregnancy, blah, 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 like not wanting to really share the news quite yet because we had just found out I was pregnant. So we had a lovely time. I did not partake in the alcohol, but it was amazing. And I was feeling pretty good, feeling just fine. So fast forward a little bit of time. And I think maybe I was about 7 weeks pregnant at this point. And I want to preface this. We will never know why you have a miscarriage, why I have a miscarriage. There are definitely reasons that I can speculate of what happened for me, but I want you to know that about 1 in 4 pregnancies end in loss, and that is a staggering statistic, guys. That is very common. So many women don't talk about their experience, or I don't know, maybe feel some level of shame or sadness, and this is not something that's really talked about that widely. But like I said earlier, I think it's really important to discuss our stories to help kind of normalize it so you don't feel so alone. Because from firsthand experience, I understand how isolating a miscarriage can feel, how sad it can feel. So I just think that sharing stories like mine is helpful to the greater collective, and to know that you are not alone, and that women have walked in these shoes prior, and that it's going to be okay. So back to the story. When I was about 7 weeks pregnant, I was starting to have some spotting. And some spotting in pregnancy and early pregnancy can be normal. You can have something called implantation bleeding. So I was like, wasn't overly concerned, but I wasn't super well settled about it. Like, something felt a little bit off. Mind you, I had just had my COVID booster shot, which in hindsight was not the right time to receive it and then immediately start trying. And then I got my booster shot. However, I got COVID like a week or two later. So while I was very early in my pregnancy, I had received a vaccine that maybe now, 2 years later, I would have chosen not to do. And then I also got COVID. So I knew my system was really overloaded with all the things, a virus, and then the toxins from the actual vaccine as well. So my system was not doing great. But mind you, I was pretty sick. My husband was very sick, and my daughter, who was only 13 months old, was very ill. So I was taking care of my family, taking care of myself, and kind of pushing things out of my mind when I was noticing that I was having some spotting and a little bit of bleeding. That in my mind, I was like, oh, I don't love what's happening. But I also knew that it wasn't my primary focus, because I was focusing on myself and my family. So that was about in January. So it was very early in my pregnancy. So as you know, I live internationally. I live here in Ghana. And around 9 weeks pregnant, we were home visiting for my family, or visiting our families over the holidays. We were traveling back to Ghana after the holidays. So I had scheduled an appointment with an obstetrician here in Ghana, and my appointment was around 9.5 weeks. And at that point, I had some pregnancy symptoms, nothing crazy. I felt a little off, I felt a little nauseous, but it was nothing in comparison to what I had experienced with my first daughter, who I was very sick with. I had severe morning sickness, was vomiting a lot. So in comparison to with the two pregnancies, my symptoms were like really mild in comparison, which now does make a lot more sense. But at the time, I was very hopeful that this was a normal, healthy pregnancy. So I had my appointment with my obstetrician here, and here in Ghana, care is different. I knew what to expect, how it was in the US when I was pregnant with my first daughter. But because I had just experienced this not very long ago, my daughter was only 13 months at this point, I was more chill about the initial first visit. It was very lax. There was not a super thorough medical history taken. And, the very first appointment, not much was done. I will say I received a ultrasound, which my sweet baby right here. So the majority of that first appointment was really just to confirm the pregnancy. And he did an ultrasound to make sure that the baby was in the uterus, not in a fallopian tube, which is considered an ectopic pregnancy. So I was laying there getting the ultrasound done, and he used the trans-abdominal wand, which goes on your tummy. Generally, when you are earlier in the pregnancy, sometimes you can have the transvaginal wand, which goes inside. But he, from what I'm remembering, used the abdominal wand. And I don't know if you can see from this image, but from what I had in comparison with my first pregnancy, it was more of a zoomed in image. So it was more this center section. So it looked small to me. Like I said, I didn't want to overstep with this doctor. I do very vividly remember asking, do you see the baby's heartbeat? And he didn't seem at all concerned, but said oh, it's still really early. We'll have you come back in around 12 weeks, and then we'll do an updated ultrasound and go from there. So that's kind of where the appointment left me. And I left feeling fairly unsettled, but also in my logical brain trying to remain optimistic, because the doctor said everything looked normal, everything looked fine. He sent us home, and we had gotten scheduled for essentially a follow-up ultrasound when I was 12 weeks. So mind you, with my first pregnancy, I had an early ultrasound, and then I only had one other ultrasound for the anatomy scan around 20 weeks. So having this 12-week ultrasound was not what I was necessarily anticipating, but I was going with the flow and trusted his expertise. So I went on another month with this pregnancy. Same thing, mild symptoms. I felt okay, and I was trying to put any worry and concern kind of out of my mind, out of the back of my mind. So I went in a month later for this follow-up ultrasound, and I was alone. My husband was at work, and I had a friend watching my daughter. And, you know, this is when I think it is really, really, really important to tune in, listen to your intuition, listen to your gut. And I really do think we have superpowers, ladies. When we are pregnant, especially, you are just attuned to the spiritual world, to the physical world, like, because we are carrying life, and the veil is much thinner during pregnancy and birth. So I think any experiences that you're feeling, you're not just overly sensitive and hormonal. Like, I do think there's a really big purpose of why you feel so attuned to emotions and all of these things. So that being said, I got called back to do the ultrasound, and the technician initially was doing the abdominal wand. And this is instantly when I knew that things were not good, because he was like, how many weeks do you think you are? So that's sending off alarm signals in my mind. And I told him I'm 12 and a half weeks. And he's like, okay, I need to use the transvaginal ultrasound wand because this is going to give us a clearer picture. You guys, I am not naive. I knew what that meant. I had recently been through this experience before with my daughter. So I knew that when he had to use the transvaginal wand, that this was going to give him a better image of a smaller baby than what would be anticipated at 12 and a half weeks. So he does the scan, and immediately I'm looking at the screen. I could see that there was no fetal heart rate. There was no heartbeat. And it was so hard. Okay, it was so hard to receive the news. I was alone, and this is not to anyone's fault, because when you work in the birth world, and this is something you're doing so routinely, like I said, 1 in 4 pregnancies can end in miscarriage. So for this gentleman, you know, sharing this news with me, this is something that he does probably very often. So initially I was like, you know, felt a stark sense of reality, and it shook me. And, you know, he told me you can get your clothes back on and sit up. And I got off the table and sat in the chair while he was kind of writing the report. And that's when, boom, everything hit me, and tears started flowing. And the reality, you know, hits you like a ton of bricks. It doesn't matter if you have the intuitive knowing that, maybe this is not a viable pregnancy. Hearing the reality makes it very stark and shakes you, that, you know, maybe what you were thinking, and when the reality combines, it's really hard news to receive. So he was very kind, like I said, but he was trying to encourage me and reassure me that many times when miscarriages occur, it's because there's some sort of genetic abnormality. And yes, it's nice to hear some rationale from a logical mind from a man, but it doesn't matter. Unfortunately, it really doesn't matter what people have to say, because you have to process this experience on your own. You have to grieve what could have been. You have to grieve it's a true loss. It is a loss. And from what I have found is that, you know, the only people that can truly relate are women just like you, who have walked in your shoes and have had this experience before. You know, receiving this news at 12 and a half weeks was freaking hard, because here I was thinking oh, I'm about to be in the clear zone. I'm about to walk into the second trimester and, you know, have a healthy baby. But unfortunately, I went truly a full month of carrying a baby that had passed without truly knowing it, because he measured the length of the baby and the gestational sac, and I was only measuring about 9 weeks. And here's the kicker, guys. There's a reason why those alarms were going off in my mind at my initial visit, because truly, if the baby was measuring at 9 weeks and I was 12 weeks along, at my initial visit, my doctor should have detected that I had lost the baby already. And, you know, I can point fingers and be upset that why didn't this doctor tell me? Or maybe he didn't know, and question his abilities to, you know, be in this field. But that's not what I'm getting at. Everything worked out for a really purposeful meaning. And let me explain to you why. So, you know, back into that seat, very emotional. I was trying to get it together. It's really hard. I felt so alone because I was alone, but also the fact that I didn't have my husband with me as my support person felt really tragic, quite frankly. So I called him, or I texted him to let him know what was going on. And he came to the clinic to come pick me up, and, you know, just told him what happened and that we lost the baby. And yeah, it was hard for him too, but I think for the mother going through it, it's such an emotional and physical and spiritual experience that your husband or your partner may not fully comprehend, like, the depth of what you're experiencing. Okay, so we get home. And so then you're in this predicament, right? So you've learned that your baby is no longer with you, and you haven't had the actual miscarriage yet. So there are different options. And this is why I think it's really important to talk about these things, because you need to know what your options are. So I felt very sure that I wanted to avoid any unnecessary procedures if possible. I wanted to wait for my body to recognize what had happened and for it to have the miscarriage naturally on its own. I also knew that there were other options, and that there was a medication option that essentially is going to help stimulate the uterus and help pass the content of the uterus to complete the miscarriage that way. And then other women, I know it's especially common in America, is to have a D and C, and that stands for dilation and curettage. And that is a procedure where generally women are put under anesthesia, and your cervix gets slightly dilated. That's the D. And the curettage is they're using an instrument that is like a vacuum suction that's going to help remove all of the content of the uterus. That is what I wanted to avoid in Ghana. It's nothing about Ghana in particular. Whether I was in America or in Ghana, I wanted to avoid that procedure at all costs if possible. I knew that I had a deep sense of knowing that my body was going to recognize what it needed to do. And I was willing to give it the time required to identify that this is not a viable pregnancy, and that it needed to do what it had to do to have a natural miscarriage, to rid what was in my uterus and get us past it. So that's what happened. I essentially switched doctors. I felt like I did not need to go back to that original doctor. And I met with another doctor to talk about my options, like we just discussed. Waiting naturally, potentially using medications to stimulate the process, or if necessary, having a D&C. And by the time I went and saw this doctor, I had gradually started to have more bleeding, more spotting. Nothing major had happened, but I knew that my body was starting to recognize what it needed to do. So I will say that it was a massive blessing being here in Ghana, because this new doctor that I met with was very hands-off. He was extremely willing to let me have the time necessary to see what my body was going to do and kind of await the onset of the miscarriage to actually happen. And then we talked about the medication options as kind of like a backup plan, and then like the last resort would be to have a D&C procedure. So after that appointment, at this point, it was about 12 and a half weeks. I had started to have more spotting, started to have some more cramping, and I had a really accurate idea in my mind of when things were going to happen. And I will say this, ladies, that I think once the reality hit and it connected in my mind, it allowed me the opportunity to connect with my body and my baby and allow myself to let go. I know everyone is different, but like I said, I think being pregnant, going through all of this is like a very tender time that puts us in touch with other elements of ourselves that maybe we're not really tuned into. So I remember kind of pushing my daughter in the stroller, and I was listening to a song that really struck me. And I talked to my baby. I said, okay, like I knew it was a girl. I had done an early blood test. And I told her, like, it's okay to let go. It's time. And I think it was the connection my body and brain needed to be willing to let go of this pregnancy. So this was 2 years ago, this March. I had the miscarriage on March 4th. And the night before I actually had the miscarriage, like I said, I knew it was going to happen. I knew it was coming. I preemptively took some ibuprofen, so that was going to help with the cramping sensation. And guys, like, you're going into labor, essentially. Yes, you're passing something that is much, much smaller than a full-term baby, but your uterus still has to do a lot of work to get everything out. So I went to bed. I put on a big pad with the anticipation of the bleeding. And I will say, I think it is very minimized about what a true miscarriage experience is like. It depends how far along you were in your gestation. I think if you're, 5 weeks pregnant and essentially like you just found out you're pregnant and then you start to bleed, that's different. It's going to be not as intense. But for me, I was 12 and a half weeks. The gestation of the baby, she had stopped growing at around the 9-week mark. So she was not very large, but it was still a significant amount of content that needed to exit my uterus. So this is your trigger warning. I woke up to a very saturated, soaked pad. And I woke up and I knew that this was it. This is what I was waiting for. And in some regard, felt a relief that it had started. And I was really proud of my body that it knew it was time and this is what was necessary. So I got up to use the toilet, and this is what is a lot, guys. I sat on the toilet and I felt a massive amount of material, clotting, everything exit my body. And it was shocking, okay? It wasn't just a little trickle of blood. It felt like a lot because it was. And simultaneously to this moment, I felt a massive release, a massive sense of relief from this experience, knowing that, like, as hard as it was to let go of this baby and this pregnancy, I was so proud of my body for having the wisdom to handle this on its own and to let my body handle it naturally. So after that, I put another pad on. I knew that this was likely going to be a couple hours of more actively bleeding. So I went and laid on my couch, and I just was experiencing the feelings, feeling sadness, feeling relief, feeling pain because it's not comfortable. Your uterus is contracting to push, and let everything come out. Okay, so it really did feel like early labor and labor contraction pains. So again, a couple hours later, I had a soaked pad. I got up to use the toilet again. Another episode happened where large clots were passed. And I remember feeling shocked, like, whoa, like still so much is coming out. So that is just something to be very mindful of. To know that you are safe, that if this is what you're going through and this is what you're experiencing or have experienced, this can be very normal, okay? This is like, it's important to not just act like this is nothing because it is absolutely something, okay? So by the next morning, things had slowed down, and the process of the uterus completely clearing itself had definitely passed, and then you're going to have residual bleeding that is more like a period. So that's what was going on. I had a period-like flow, and I was feeling okay. I was feeling glad it was over. I was feeling relieved. I was feeling very proud of my body and proud of myself for sticking to what I wanted and not feeling any sort of pressure from society to just speed this up and get it over with. I think the detriment to our society is that we just want everything to be gone. We don't want to feel things. We just want things to get up and hurry up. And, this is not to say that for you, if you learn that you have a miscarriage and you feel like the best way to go about it is to have a DNC, then that is your right, okay? But you need to know your options. And I do think that by experiencing the miscarriage, it really allowed me to go through that grieving process more real. I didn't just wake up from a procedure and learn I wasn't pregnant anymore. I felt it, I experienced it, I worked through it, I cried, I was in pain. It's all the things, this is not like a glamorous experience. And I don't want, anyone that's experiencing this, I want to just be very, very real about what it can look like. And once again, this is my experience. Your experience is going to look different. But I do think it's helpful to share my story. So after that, the bleeding had stopped, and I was recommended to go in for another ultrasound to confirm that everything in my uterus was now out. And I had that experience. So I went in, and it was really odd because normally when you're wanting to be pregnant, you want to see a baby and they're so bad. And for this situation, you wanted to see a completely empty uterus, meaning that nothing was retained, no tissue was retained, because there can be like incomplete miscarriages where then like a DNC truly is required to help get everything out. But for me, I had completed the miscarriage, everything was out, and that gave me essentially a clean bill of health that, when I was ready to try again, that would be a great option. Okay, so fast forward, like I said, because I truly experienced this miscarriage, the desire to have another baby did not go away. I was wanting another child so deeply, and the miscarriage experience gave me lessons that I didn't know that I needed, but the desire to have another baby didn't go away. So, a couple weeks passed, and we're getting through everything. My husband was kind of gradually taking things in as well, and he was deeply saddened by the whole experience. But like I said, the woman going through it's experiencing it on an entirely different level. So, it was interesting. I paid attention to my body's cues. I had watched other YouTube videos like this where people got pregnant again right away. And I really wasn't thinking about that. I was thinking we're gonna do our thing and not prevent pregnancy from happening. But also I just want to give it to God truly. And I knew that, I just needed it's out of my hands at the end of the day. What control do we really have, right? But I was paying attention to my body signs. I think when you're in your reproductive years, you really pay attention to your cycle. You pay attention to your cervical mucus. So if you do not know, when you're ovulating, you produce a cervical mucus that looks essentially like egg whites. It's stickier, it's stretchier, it looks like egg whites. Okay, so it's slimier. But the reason for this is why our bodies are so amazing. The reason for this type of cervical mucus is it's very welcoming to sperm, to semen. It's allowing things to get into the uterus very easily and promote pregnancy. So during an ovulation period, you're gonna notice that cervical mucus looks more like the egg white consistency. So in my case, this was still March, and I had noticed, looks like I'm ovulated. And also, we were living life. My husband and I were enjoying each other, and I knew that we may have done the deed right around that ovulation signal. And fast forward a little bit of time, I remember doing dishes. It had been a couple weeks since the miscarriage experience, and it struck me again. I felt like immediate sadness of what could have been and the desire for another baby. And I remember doing the dishes crying like to my husband, like, what if it takes us 6 months again to like get pregnant? Like, I just was in that fear mode where I just didn't know what was going to happen, and if it was going to take me a long time to get pregnant, and when we were going to have another baby. Like, all of the emotions were still there. And little did I know, I was actually pregnant again with my beautiful rainbow baby, little June back there. And boy, were we very pleasantly surprised, but we were shocked. Okay, so I had my miscarriage very early in March, and I learned at probably the early April that I was pregnant again. So I got pregnant within the same month of the miscarriage, which really can happen. I think it takes a lot of people off guard if that's what you've experienced. And obviously it's no guarantee that if you're wanting to conceive again really quickly, there's no guarantee that it can happen that quickly. But in my case, it was. So I want to briefly say and preface that while it was after I had had my miscarriage, I had a million of these little pregnancy tests. And what I did was I would take these pregnancy tests intermittently. And we all know when we're pregnant, there's like 2 solid lines, right? So I was doing this every few days to inversely watch this second line fade. Super sad to watch, but I felt like that was something I needed to do. So I knew that the HCG levels were dropping. And also my intention was that if I were to become pregnant again soon, I wanted to know that when I took a pregnancy test, the second line was from a new pregnancy and not the residual HCG levels left in my body prior with that second pregnancy. So that I think these are really helpful. You can get a pack of 100 and they're cheap, and you can just kind of watch your levels decline. That was helpful to me. So early April, I think this was April 11th, and 11 is my special number. So I remember telling myself, if I don't get my period by April 11th, I'm going to take a test. So wouldn't you have it, I took a pregnancy test on April 11th, and it was positive. Part of me was like not surprised, because this is what I was really hoping for. And I was attuned to my body. I knew that we had sex while I was ovulating, so there was definitely hope there. But another part of me was like, wow, like, this is incredible. Like, this baby is for me. And I think this is where women can have 2 really different experiences, where you have a lot of fear around getting pregnant again, being scared that you can lose this baby as well. But for myself, I had such faith that this baby was here to stay and that she was going to make it earthside, because I felt like if I were to become pregnant again so quickly, that this was the baby destined for me. And I think, to be honest, this is not a very religious YouTube channel, but for me, truly, like, I became closer to God than ever and in my faith when I had my miscarriage experience, because I truly knew deep down that I was gonna, have another baby, and I just had to give it up and give it to God. And that's exactly what happened. So I got pregnant again really quickly, and I was pregnant with my sweet baby June. So with a rainbow pregnancy, a rainbow baby, I think it's important to know that if this is a baby that's meant for you, this baby's going to be with you, okay? So because of my miscarriage experience, I really trusted and had faith in my body. I relinquished all of the insane crippling fear and anxiety that can come around pregnancy after a loss. And that was really helpful to me, because I could go through my pregnancy with excitement and enthusiasm and hope. And because of my experience, and because I experienced my miscarriage naturally, I had faith in my body that this baby, if she was for me, which she was, my body would know what to do, keep her safe, and have a beautiful, healthy pregnancy. And it was helpful that with this third pregnancy, with my second daughter, my pregnancy symptoms hit me like a ton of bricks when I was 7 weeks pregnant. I was very, very sick. I was throwing up a ton. And interestingly enough, my in-laws came to visit us here in Ghana. And once again, they were the first to learn that I was pregnant. And my mother-in-law is an angel on this planet. She had recently just had a dream that I was pregnant again, and she was absolutely elated to hear the news. Because when you go through a miscarriage, guys, yes, it's affecting you, most importantly, of course, but those that love and care about you are really saddened by this experience as well. So it really is a loss for everyone. So my pregnancy went really well, and it was hard in the beginning, of course, but I went on to have a normal, beautiful, healthy pregnancy. And I will say, I think having had my natural miscarriage experience, it really helped mentally prepare me to have a completely natural, unmedicated birth with my second daughter. And that was always my intention with my second baby. I always wanted to have a completely natural birth. And I can see now, having gone through everything that I did, how it better prepared me for my second birth, but also for what I want to do. You know, I'm studying to be a midwife, and I think this journey has been helpful to me to be able to empathize and relate to women that have gone through this experience, that are experiencing a pregnancy loss and maybe are feeling a little hopeless and saddened. I'm here to tell you that please trust the process. There are lessons to be learned here. It's not to, negate the fact that you're feeling really sad and are feeling really emotional about everything. But I want to give you hope that this is just part of your story. This is not the full picture, and that I hope and pray for you that you have an amazing pregnancy and birth following this really challenging experience, and you'll have your amazing, beautiful rainbow baby. So in hindsight, I would not change anything that I've experienced, even when it felt so hard and so sad, because it got me the little person that was supposed to be here all along, and that my little angel baby's looking out for us, and maybe our souls will meet again. We'll see, who knows. But if this is something you're experiencing or recently experienced, I'm with you. I feel for you. Reach out to other women that maybe have gone through the same experience. I really think that can help immensely. So I hope this was helpful. I hope it was encouraging. And I look forward to seeing you in the next one. It's going to be okay. See you.